An urgent health warning is issued for individuals over the age of 60, especially those who diligently take vitamin B12 supplements every morning, as this common routine, often undertaken with the best intentions for health and longevity, may be unknowingly setting the stage for increased risk of serious cardiovascular events. This critical information, which often goes unmentioned in routine medical checkups, concerns the interaction between vitamin B12 and two specific, widely prescribed medications. While millions of people over 60 believe they are doing everything correctly by supplementing with B12 to combat age-related absorption challenges, an invisible and potentially dangerous process may be occurring internally. Unlike many serious health conditions, this silent interaction rarely presents with immediate alarming symptoms such as chest pain, dizziness, or pressure, making it easy to overlook and ignore until a significant event like a stroke or heart damage occurs. Research has indicated that combining high-dose vitamin B12 with certain common medications can lead to the formation and accumulation of a molecule known as homocysteine. Homocysteine acts as an abrasive substance on the internal walls of arteries, essentially sandpapering the delicate lining of blood vessels, which significantly multiplies the risk of suffering a stroke or other cardiovascular complications. Understanding which medications cause this dangerous interaction and, more importantly, how to protect oneself is crucial for anyone managing health proactively in their later years. A notable study published in a prestigious medical journal revealed a counterintuitive finding: older adults taking high-dose B-complex vitamins, including B12, over an extended period showed an increase in cardiovascular risk under specific conditions compared to those taking lower doses. This finding, initially surprising to many in the medical community, makes complete sense when considering the underlying mechanism of homocysteine accumulation. Consider the example of a 71-year-old retired school teacher, active and sharp, who prided herself on taking excellent care of her health. Every morning she would take a handful of supplements with her breakfast, including high-dose B12, based on the common knowledge that nutrient absorption decreases after 60. She felt she was being proactive, but she had been taking metformin for type 2 diabetes for nearly 8 years without interruption. Crucially, no healthcare professional had ever clearly explained to her the long-term effect of metformin on B12 absorption, or what happens when the body tries to compensate for that deficiency. Her daughter eventually noticed a persistent, uncharacteristic fatigue in her mother that no amount of rest seemed to alleviate. Subsequent blood tests, specifically requested for homocysteine levels in addition to standard B12, revealed a dangerous pattern. Her homocysteine was alarmingly elevated, while her B12 levels appeared high due to supplementation. This paradoxical combination indicated a history of silent vascular damage that had developed over years, precisely while she thought she was doing everything right. This scenario highlights how the B12 medication combination can create a problem that standard medical checkups rarely detect without specific testing. The first medication to be aware of in this dangerous interaction is metformin. For those with type 2 diabetes, metformin is a cornerstone treatment and highly effective for blood sugar control. However, metformin has a side effect that is frequently overlooked or poorly communicated to patients. It interferes with a protein in the intestine called intrinsic factor, especially over years of consistent use. Intrinsic factor, produced by the stomach, acts as a transport vehicle for B12. Think of it as a taxi service. B12 needs to board this taxi to be carried into the bloodstream and used effectively throughout the body. Metformin silently damages this transport system, making it less reliable and consistent. When a doctor sees low B12 levels in a patient taking metformin, they logically recommend a B12 supplement. The patient then takes a high-dose supplement, often believing that more is better, which temporarily raises B12 levels in the blood, leading the doctor to conclude the issue is resolved. However, what this standard blood test fails to show is the state of the system downstream. Because the intrinsic factor system is compromised by the metformin, the B12 cannot be adequately processed and transported. Instead, it interacts poorly with homocysteine in the bloodstream. Homocysteine, a naturally produced amino acid, is harmless in small amounts. The body normally uses B vitamins, B12, B6, and folate, to convert it into something useful and clear it from the blood. When this conversion process breaks down due to B12 not being correctly processed by the impaired intrinsic factor system, homocysteine accumulates to dangerous levels. Elevated homocysteine has a specific and harmful effect on the cardiovascular system. It acts like sandpaper on the inner walls of arteries, causing chronic abrasion. A study in a prestigious medical school described it well. High homocysteine doesn't cause a sudden blockage like a blood clot, but rather a chronic inflammation and stiffening of the arterial wall, which facilitates plaque formation. It also hinders the artery's natural ability to expand and contract with each heartbeat, making it rigid. Ponder your arteries as flexible rubber hoses. When healthy, they stretch and retract effortlessly with every heartbeat. But when homocysteine has been sanding those walls for months or years, the hose becomes more like a stiff plastic pipe. Stiff pipes don't flex under pressure, they crack and rupture. In the cardiovascular system, such a rupture can lead to a stroke or cardiac event. This interaction between metformin and B12 supplementation is occurring daily in many individuals, yet the connection is rarely made by healthcare providers or patients. The second medication that presents a significant risk with B12 supplementation is even more common, and its interaction mechanism is different but potentially more erratic. These are proton pump inhibitors, PPIs, widely recognized by names like omeprazole and pantoprazole. These drugs reduce stomach acid and are routinely prescribed for acid reflux, ulcers, and general stomach protection. PPIs are extraordinarily common among older adults because acid reflux becomes more prevalent after age 60 as digestive function changes. However, PPIs do something most patients are never fully informed about. They reduce the stomach acid required to liberate B12 from food. Your body needs a sufficiently acidic environment to break the protein bonds that hold B12 in food sources. When PPIs reduce this acid over months or years, B12 absorption from the diet significantly decreases. A study published in a respected medical journal tracked over 25,000 patients on long-term PPI therapy and found that after just 2 years of continuous use, these patients exhibited measurably lower serum B12 levels. The logical solution proposed by most doctors following this finding is to recommend a B12 supplement. However, for certain individuals, particularly older adults with potentially reduced renal function, the supplemental B12 cannot be processed or excreted efficiently. It builds up in the blood in a form that interacts poorly with the homocysteine cycle. Furthermore, some patients on long-term PPI therapy develop rebound acid hypersecretion. When they stop the medication or when the drug metabolizes overnight, the stomach overproduces acid in a compensatory response. During this rebound window, the high-dose B12 supplement is processed in an unpredictable environment. Erratic absorption means erratic management of homocysteine. Some days the body clears it, other days it doesn't. This complex situation adds another layer of risk and underscores the importance of a detailed discussion with a physician regarding all medications and supplements. The key to understanding this entire problem lies in homocysteine. This is a value that almost never appears on a standard blood test. Your doctor typically checks cholesterol, blood sugar, thyroid function, and perhaps total B12 levels, but homocysteine requires a separate, specific test. Cardiovascular health experts have identified elevated homocysteine as a significant and underestimated risk factor for cardiovascular disease in adults over 60. Yet, most seniors have never had their homocysteine measured. The reason this is critical is that when homocysteine levels remain elevated for months or years, three things occur within the cardiovascular system. First, the inner lining of arteries becomes inflamed and loses its natural smoothness. Second, small oxidized LDL cholesterol particles find it easier to embed themselves in those inflamed walls and form plaques. Third, and most crucially, plaques formed in an inflamed environment with high homocysteine are more likely to rupture unstably. This means they break off and travel through the bloodstream rather than remaining fixed in place. This final point explains strokes in individuals who show no large blockages on medical images. The plaque was there, but it was unstable and broke free. Researchers in leading clinics have discovered that elevated homocysteine is present in a disproportionate number of these unexplained strokes. The cause wasn't mysterious. The right test simply wasn't requested. This information is not intended to create panic without providing actionable knowledge. Its purpose is to empower individuals to regain control of their health. The solution is not to stop taking B12 entirely, as B12 is genuinely essential, especially after age 60, where deficiency can cause nerve damage, fatigue, cognitive decline, and its own form of cardiovascular risk. The goal is not less B12, but smarter B12. First, if you are taking metformin or a PPI, the most important step right now is to ask your doctor for a specific test. Active B12 levels, holotranscobalamin, and homocysteine levels. Do not settle for total B12 alone. Active B12 reveals what your body is truly using, as total B12 can appear normal while active B12 is deficient. Second, the form of B12 matters enormously. Most supplements contain cyanocobalamin, which is the cheapest form to produce and requires your body to perform several conversion steps before it can be used. For older adults taking metformin or PPIs, these conversion steps are often compromised. The form known as methylcobalamin bypasses most of these steps as it is already in an active, usable state. Research published in specialized journals has shown that methylcobalamin more reliably raises functional B12 levels in older adults than cyanocobalamin at equivalent doses. Third, dosage is more critical than most people believe. High-dose B12 supplements ranging from 1,000 to 5,000 mcg daily are commonly sold and consumed, yet the body can only absorb a small fraction of this without intrinsic factor. The rest floods the blood in a form that can drive the homocysteine imbalance discussed. A more specific dose of 250 to 500 mcg in methylcobalamin form combined with B6 and folate provides the homocysteine cycle everything it needs to function correctly without overwhelming the system. Fourth, engage with your doctor specifically about your list of medications in relation to your supplements. Bring this topic to your next appointment as a specific agenda item, not a casual question, by stating, "I want to discuss my B12 supplementation in relation to the medications I am taking." This single conversation could change the trajectory of your cardiovascular health. Let's consider another example. A 74-year-old individual had been taking a PPI for 14 years and a B12 supplement for the last 5 of those years. Their daughter, having read information about homocysteine and heart health, brought her mother to the doctor with a printed article. The mother was initially skeptical. She felt fine. Her blood pressure was controlled and she walked her dogs daily. However, her homocysteine test returned a result of 31 micromoles per litre. The safe range is generally considered below 15. At 31, she had more than double the level associated with significantly elevated stroke risk, yet she had no symptoms or warnings, only a number on a sheet explaining precisely why her arteries were working harder than they should. Following these results, her supplement form was changed to methylcobalamin, and a low-dose B6 and folate supplement was added to support the homocysteine conversion pathway. Her B12 dose was scheduled for a different time than her PPI dose to maximize absorption. A follow-up homocysteine test was scheduled for 90 days later. When she returned 3 months later, her homocysteine had dropped to 17. It wasn't perfect yet, but it was moving in the correct direction. She commented that she hadn't realized how tired she felt until she started to feel less exhausted. If you have been in a similar situation for years, understand that it is not too late. The body has a remarkable ability to recover and rebalance when provided with what it truly needs. The vascular inflammation caused by homocysteine is not permanent if caught before a major event, and this case proved it in just 90 days. Here is a clear action plan for your health. First, review your medications. Are you taking metformin for diabetes, or a PPI like omeprazole or pantoprazole for acid reflux? Knowing your full medication list is fundamental. Second, examine your B12 supplement. What form is it? If it lists cyanocobalamin, you need to consider switching to methylcobalamin, which is more directly usable by the body, especially in older adults. Third, check your B12 dosage. If you are taking more than 1000 mcg, you may be overdoing it, which can be counterproductive. A more moderate, targeted dose is often more effective. Fourth, schedule a homocysteine test. Call your doctor tomorrow and specifically request a homocysteine level test along with an active B12 level test. Do not settle for total B12, insist on active B12. Fifth, consider adding support with B6 and folate. These vitamins work synergistically with B12 to process homocysteine properly and efficiently, optimizing the metabolic cycle. What you have learned today is this: metformin and B12 can create a dangerous interaction via the intrinsic factor pathway, leading to high homocysteine and arterial damage over time. Proton pump inhibitors reduce the acidic environment needed for B12 absorption and create an erratic processing environment that disrupts the homocysteine cycle. Homocysteine is almost never tested on a standard panel, and elevated levels in seniors are a significant underestimated cause of stroke and cardiovascular events. The solution is not to stop B12, but to switch to methylcobalamin at a smarter dose with B6 and folate support. If this information has helped you understand a hidden danger, please share it with anyone over 60 taking these medications. Your action in sharing could literally save someone from a stroke. This information should not be considered medical advice. Always consult with your healthcare professional before making changes to your supplement routine, especially if you are taking medications. Thank you for trusting this source for your health education today. You now know something most people are never told, and that knowledge belongs to the people you love. Take care of your heart.